This lecture is going to be covering the nature of communication and language impairments in children with autism. When we talk about a child's communicative competence who has been diagnosed with autism, there are some important predictors of positive outcomes that the child will continue to develop verbal communication. And some of the characteristics that we might see is development of the use of multi-word combinations spontaneously and used in a communicative way to interact with others on a regular basis before the age of 5. So that behavior is considered a important predictor for that child to continue on in acquiring verbal communication. We also look at IQ levels, language measures, and the child's ability to demonstrate adaptive skills. So specifically skills related to problem solving or being able to adapt to a current situation or environment. And also academic achievement is also looking at that as a prognostic indicator, and knowing that obviously communication skills will impact a child's ability to progress academically. An important issue that you need to be aware of is that the child's communicative impairment is often the greatest stress for families, and is obviously will prevent that child from engaging in appropriate social relationships and being able to relay any information, thoughts, and needs to others. Obviously, if the child has significant impairments with communication, that's going to prevent that child from being able to successfully, again, communicate and relay information to others. Children with autism will often demonstrate deficits in two major areas that dramatically impact communication skills and then and further development of language. And the first one is capacity for joint attention. So the child is demonstrating difficulty coordinating attention between people and objects. So for instance, if a child is engaged with a particular toy, they will often be very fixated on the toy and not be able to change their attention from the toy to then the other person who might be trying to play with them in order to jointly attend to the toy together. So there is a great difficulty in engaging in joint play activities because of this difficulty with joint attention. The other area that dramatically impacts communication and language development is a child's capacity for symbolic development and use of symbols. Overall, there's a difficulty learning conventional or shared meanings for symbols. And we know that if there is difficulty with this particular skill, then a child is going to have further difficulty acquiring language, and then of course engaging in any kind of symbolic play or pretend play. Again, and to reiterate that language is a way of using various symbols, okay, that have various meanings. So the words that we use in our language are symbols and stand for many different things. So if a child with autism has difficulty with symbol capacity, then it's going to directly correlate to their ability to learn words, which are symbols as well. This slide focuses more on specific aspects of joint attention and how limitations in joint attention among children with autism is closely linked to deficits in play skills, emotional responsiveness to others, and peer interactions. Joint attention is also a predictor of language development. So if a child has significant difficulties engaging in joint attention with others, then that will adversely affect their potential for language development. So during moments of joint attention, the child is able to orient to social stimuli. So meaning able to orient to others and engage and react to others socially. We see that children also coordinate eye gaze between objects that they're playing with and their caregiver. So that coordination of eye gaze, again, is an observable behavior that lets us know that the child is engaged with the other person that they're with, and also attending to the particular object or event that's occurring. Also, during moments of joint attention, children display affect or emotion, and they also work on reading or interpreting others' facial expressions. So during joint attention, it's an important moment for children to learn about emotions and coordinate and correlate individuals' facial expressions with particular emotions that might be occurring. So children with ASD are seen to respond not as often to a mother's smile than typical children. So again, they don't have as much a reaction to those types of social signaling than typical children. So during joint attention, when the child is coordinating their attention between objects or events and then others that are with them, it's a critical moment for language learning. The child is orienting and attending to their social partner, and when they have that attention to the social partner, they're learning language and learning the words that are being modeled and spoken during these moments of joint attention. And again, they're able to learn different emotional states and facial expressions that individuals demonstrate during those different emotional states. And they also learn to be able to get others' attention themselves through appropriate social gesturing and vocalization to draw others into something that's interesting related to an object or event. So to talk a little bit more about a child's ability to acquire symbol skills and ability to use symbols for language and communication. Children with ASD demonstrate fewer vocalizations to express intentions during early stages of language development. So this could be a sign that the child is having difficulty with the cognitive development of symbolic abilities. We also see that children with autism use more limited gestures when communicating, and they may demonstrate more primitive or pre-symbolic motor gestures. And this relates to behaviors such as hand leading, when the child will take another adult's hand and lead them to something in the environment that they're trying to request or communicate about. So they don't necessarily engage in behaviors of showing other people items of interest, items that they want to play with another person. They don't necessarily engage in other gestures like waving, pointing, and using head nods. And children with ASD also do not use gestures to compensate for their lack of speech or verbal communication development, like other children with developmental disabilities that we see, such as children with Down syndrome or even cerebral palsy, for those children who physically could produce gestures. Again, children of those disorders are seen to attempt to use a lot more gestures to communicate socially and to communicate their wants and needs with others because of a lack of speech development. But again, we don't see that same type of correlation or behavior necessarily among children with ASD. So children with ASD often demonstrate echolalia, which is defined as a repetition of language that is heard by others. And it doesn't present as having a direct meaning when the child is demonstrating it. However, I will talk about a little bit how that can transform into a little bit more functional communication. So a child may repeat a single word for a label or a situation or event that they've heard spoken by others. So echolalia can be immediate or delayed. And when it's immediate, it means then that the child, when asked a question, for instance on the slide here, it says the child was asked, "Do you want a piece of candy?" And the child then would immediately respond with, "Do you want a piece of candy?" versus answering themselves, "Yes," or "I want candy." So that is an example of immediate, where they're immediately repeating what is being said to them. It also can be delayed, meaning that then the child will repeat phrases or words they've heard others spoken to them or in their environment at later points in time. There's different research to say that in the past, echolalia was thought of as something that was a negative behavior. However, some research is now indicating that it's actually a strategy for children with autism to try and use language heard by others. So they may be repeating phrases that they have heard associated with situations in order to try and find out how they work. So more of a trial and error type of situation. And children who do progress with verbal communication from echolalia then end up breaking down these echolalic chunks of language into smaller, meaningful units, into a more functional language system. We see children who do repeat questions. They'll repeat the pronoun that is heard. So again, when their child is asked, "Do you want a piece of candy?" they would repeat, "Do you want a piece of candy?" versus "I want a piece of candy." So use and acquisition of pronouns is often very difficult for children with ASD. And again, research is indicating that children may be using echolalia as a way to participate in a communicative exchange, in a way to use verbal communication, because they're having difficulty using their own novel utterances and own word retrieval abilities themselves to produce verbal communication. So again, echolalia should be seen as something more positive versus something that should be extinguished, and it's a sign that the child has a capacity for verbal communication, and it's something then that should be considered as a stepping stone to then work on developing more functional verbal communication. To talk a little bit more about reenactment strategies and how it relates to a child's further development of symbolic abilities. And when a child does engage in reenactment strategies, it is seen again as a positive sign that the child again is anticipating events that occur during their daily activities, and they're associating various objects or events to a activity or event as a whole. So again, a child may use an adult's hand and place it on a door handle to ask to be let outside. So again, the child associating and knowing that action is associated with them being able to go outside and play. A child may go and retrieve car keys and hand this to mom or dad to request a car ride. So again, they're using the car keys as a symbol to then make that kind of request, and then associating and knowing that you need car keys in order to drive the car. Another example is a child may repeat a memorized portion of a song to actually request to sing the entire song. So again, these are emerging skills in symbolic development, and stepping stones again to further advance symbolic skills and language abilities. So again, we see reenactment behaviors occur at early stages of typical communication development. So very young children, before they acquire words and starting to use words for communication, they will demonstrate some of these types of reenactment behaviors to make requests. So again, it's a sign of emergence of symbolic abilities and being able to then progress with symbolic communication, and understanding that a symbol stands for something else and is separate from a whole entire object or event. It may be, however, that some children with ASD who fail to further develop their symbolic communication skills remain at the reenactment stages of communication. So again, it's important to know that these behaviors are the emergence of communicative intent. So the child is demonstrating intent to interact with someone, to get a want or need met, which is again similar to stages of normal language acquisition. This slide has some information about some of the unconventional means of communicating that children with ASD may demonstrate. And they may demonstrate undesirable behaviors such as self-injurious behavior, aggression, or tantrums. And the function of these undesirable behaviors can vary. It may be used to get attention from others, escape from a task or situation. It might be to protest against change of the schedule, or to regulate social interactions. And overall, children demonstrate these oftentimes types of behaviors when they have overall limitations in symbolic capacity, and then affecting their ability to further develop their language skills in order to more appropriately communicate negative feelings and desires or wishes to terminate activities or situations. So I have an example here that though it's possible to try and shape a negative behavior, such as a child slapping their face in order to protest, and what happens in this situation is that then the child will often hear, "Will you stop it?" when that behavior would occur, and then they end up starting to repeat that echolalic utterance. So they're repeating, "Will you stop it?" In order to protest, and then finally then using the word no. So again, the child has heard no as well, and then they start repeating that word no in those moments when they would like to protest or refuse a situation. Children with ASD may demonstrate difficulties with development of play skills because of their limited symbolic abilities. So you may see children with autism have difficulty with overall interactions and appropriate play with objects, and then you also may see difficulty with make-believe or pretend play. You may see them having difficulty using pretend actions with objects. And again, symbolic play is acquired through observing others, engaging in those different actions or events. And then when children observe, for instance, mom and dad cooking in the kitchen, and the events and actions that are involved with cooking, the child remembers those observations and then acts those observations out in their own play. Again, symbolic development is associated with receptive and expressive language development. We know that the words we use for language are symbols. So really symbolic abilities is really the foundation for a child's potential then to use words symbolically for communication. Also, through symbolic play, a child is also working on using gestures. They're also acquiring language during those episodes of symbolic or pretend play, and they're also working on understanding appropriate use of objects. So, the difficulty, again, with children with autism being able to engage in these types of activities does affect their ability to progress with language through that type of modality or learning modality. The Communication and Symbolic Behavior Scales by Weatherby and Prezant is a popular assessment tool that's been around for a while, and assesses these different areas of communication ability in children with autism. So again, we're looking at these different areas of communication development to then help us plan out then our intervention goals and identify weaknesses that can be targets for therapy. So again, we're looking at the different communication functions that the child may have, and that's use of gestures, sounds, words for behavior regulation, and any type of communication functions that might be occurring during moments of joint attention. We're also looking at the child's ability to use gestures and coordination of gestures and use of vocalizations for expressive communication. We're looking to see if a child is using any type of vocalizations as well, even without gestures, to try and communicate. If there's any inventory of development of consonant sounds and the use of different syllable combinations. If a child has some verbal vocabulary, we want to know how many different words they may be using for communication and if they are combining those words. We also want to see if the child has the ability to reciprocate with someone else, okay, during interactions, and respond to another adult's gestures and speech, and attempt to also communicate in response to others' communication. Want to see if there is use of eye gaze shifts between the person and objects, and if there is any kind of demonstration of emotional affect, positive affect with eye gaze towards others. And also we want to see if the child does demonstrate any episodes of negative affect, and how they handle types of negative emotions. And then of course we talked a lot about symbolic behaviors and development. So of course, you know, the Westby scale is going to look at that also in more detail. Here's some final comments about motor functioning in children with ASD. And children with ASD may demonstrate overall difficulty with motor coordination. They may be able to demonstrate the ability to acquire walking and gross motor activities normally. However, they may have difficulty with more fine motor movements and coordination, and then again whole body movements and coordinating that, for instance engaging in gym types of activities. Catching and throwing a ball may be difficult. Navigating playground equipment such as going up and down a slide independently, being able to get on and off the swing and swing independently. So some of those kinds of activities might be difficult for a child with ASD. And we know that oftentimes handwriting is an area of difficulty as related to fine motor difficulties, and also it's possible for a child to have oral motor difficulties in and also oral sensitivities to different food textures, and have a lot of aversions to different types of foods and textures. It's possible children with ASD can demonstrate apraxia. However, and as it relates to verbal apraxia, however, that diagnosis should be used with caution, and you should thoroughly assess the child's language abilities and receptive language abilities and potential for language acquisition. before automatically assuming a child is not speaking due to a motor impairment like childhood apraxia of speech. It might be that the child is demonstrating more significant limitations in overall language development, which is causing a lack of expressive communication. Also, keeping in mind that a child with ASD, although, like I said, children acquire the ability to walk, their sequence of motor development may be different. And the ages that they acquire the sequence of motor development, here I have listed lying, writing, sitting, crawling, and then walking. It might be noted by the parents that there are delays, and or they may have skipped some of these early motor skills as a infant or toddler. And you might hear a parent comment that the child went from sitting to standing to walking and then missed crawling. So that's again areas that should be areas of concern and noted for risk of neurological differences there in motor development.